with my practice in California, I had a gentleman, and I alluded to this earlier, from Kansas. He actually flew out for the surgery, and again, I don't know when you all are watching, but relatively recently we've had some tragedy in Santa Barbara, and his surgery was scheduled during this horrific fire that we just had. He had to go home because I had to cancel the surgery because my office was in a evacuation zone, and I'm a very conservative guy, and it was likely not going to be an issue, but I didn't want to be halfway through the surgery and have the police knocking at the door saying you have to go.
Firefighter trying to roll you out.
Right. So we canceled the surgery. He went home, came back after the fires and the subsequent floods that we've unfortunately had. So I did his surgery. He stayed in Santa Barbara for 2 weeks, which is not necessary, but he wanted to do that.
He's from Kansas, let's be real.
There
it
you
might
go.
have been necessary for him.
Don't hate on Kansas. I mean, we're right next to it.
So I saw him just before he left. And this is a very specific gentleman. He actually has a brain tumor, a known brain tumor, a small one that he's had for years, and he had gamma knife or radiation treatment.
Yeah.
And that's a 33 treatment thing. And on his 30th treatment, began having headaches and severe headaches. And this gentleman is financially successful, a loving family who I've met. I mean, he's got everything you would want, including and not including and a really, really bad pain issue. So we operated on him, and again, in the face of this radiation scarring, I told him that I'm not sure this is going to work, right? I mean, he's at the end of his rope. He had tried everything. And I said, I'm willing to try this, but you have to understand that it might not work. Before he left, he told me that he had been previously, again, planning on making appointments in Washington State where you can have assisted suicide because his pain was that bad. And he told me that he hadn't felt this good in years. And so on his way back to Kansas, he decided he was going to stop in Telluride and go fly fishing. Now, it is winter right now. You're going to Telluride fly fishing in the winter. You're tolerating some baseline pain right there in your legs, and this guy felt so good that was that was what he was planning and looking forward to doing, and that was just an amazing story. And again, I just feel real thankful that I get to change people's lives in that kind of fashion. But story after story about, I used to not go to my daughter's softball games, and now I travel all over the country with her. Single parents who, you got to imagine what it's like to be a parent of a small child and trying to lock yourself in a room, quiet and dark, just because you don't know what else to do. You still have a child who's got to be attended to and fostered and all of that kind of stuff, So just getting patients out interacting with their family and friends again, and it's fantastic.
Yeah, that's awesome.
I mean, I'm completely envious of the fact that you get to help people that much.
But I think it's so important, though, that people actually know that this exists.